Hello, it's nice to have the chance again to give this message to staff and by way of a general update. It's been a couple of weeks now and almost 9 weeks into this job, and still the sense of privilege remains the same. I hope it does for a very long time. I've had the chance since I last spoke with you to visit a number of services, to meet with a number of people, to meet with a number of your colleagues, people not just in leadership and management, but many people on the front line, and indeed people who use our services. Been to Letterkenny, where I've seen some outstanding work both in the hospital and in the community. The National Ambulance Service Pathfinder service is something that stands out as quite unique. I also visited a home where 4 people with intellectual disability are cared for, but they live and that's their home. And that to me perhaps has been the most striking engagement I've had since taking up this job. I had the pleasure of spending some hours in Sligo in the hospital there, and then on to Galway and to the Celta group, to Galway University Hospital, and out to so many essential but absolutely wonderful new and emerging community healthcare services in chronic disease management, in the integrated care of older people, in primary care, in mental health and in disability services. I want to thank all of the people who hosted me on those visits. I had the chance also to spend a day with University Hospital Limerick and the wonderful work that's going on there in an exceptionally pressured environment where we have so much more to do. And I look forward to supporting the totality of the health service in that region to make the type of improvements we need for the experience of the public. We saw also in the past few weeks the opening of the Rock Wing, the Mater Hospital, in excess of 90 new high-tech, high-specialised beds in a built environment that was built perhaps in record time in terms of a capital construction project in the health service. So wonderful to see that, more importantly, to see the work that emerges and that will go on there. I want to mention again briefly, as I did the last time I spoke with you, the staff survey. It's now live. I really, really do want to hear the individual and collective views of the staff. I want to hear why people stay as well as why people go. I want to hear what the experience of working in the HSE is like. And more importantly, I want to hear how perhaps in the ways that I lead and manage, I can make some difference and make some improvement to that journey of continuous improvement. And so I really hope to hear from you, and I hope and would encourage everybody to participate in that survey. And let's aim for record numbers to participate. Finally, around this time, it's International Day of the Nurse. A third of our workforce, 44,000 full-time equivalents, almost 51,000 people make up the nursing profile of this organisation. Last week, we celebrated International Day of the Midwife, another very strong profession. I had the opportunity of attending the INMO, the largest nursing union conference last week in Killarney, and the chance to address delegates there and to hear from them about the very real challenges. But around this particular time, let's celebrate the International Day of the Nurse. Let's celebrate the contribution of our nursing colleagues, the talent, skills that they bring to the care of so many. Thank you.